Hey guys, it's Dr. Emer. I'm going to bring you in close now because we're doing the Deep CO2 Laser. And the cool thing about the Deep Laser is I want to show you something. Look really close. I call this dewdrop on a rose petal. What does that mean? All those little dots. You see that little sort of speckling? Can you zoom in there? Can they see that? That water look, that water like little drops there? That is deep swelling because we went super deep with this laser. And what it's doing is it's basically breaking apart scar tissue that's underneath, creating little holes in the skin that are going to peel over the next week to 10 days. And then after those 10 days, the next 3 months is literally just gonna build collagen. And she's gonna get a remodeling. She's had lasers before. I just don't think she went to a very knowledgeable laser provider. So what we're doing today is we're customizing the treatment for her. And in this case, given that she has more of those broad, sort of deeper scars, we're going to remodel using a combination of lasers, radiofrequency, subcision, and filler. Okay, and this laser, which is pretty much the gold standard resurfacing device. This is actually the device used by the government on patients that have been burned in the military. And it's used for studies of burns and scars. It's called luminous ultrapulse. This is the Deep FX handpiece, which I will tell you, if you know what you're doing, you can get some quite amazing results. But you know what's great the most is that my patient is so motivated to get such an amazing result. She's being such a great patient, even with the nerve blocks that are painful. She's doing great. And so we're doing the deep part right now. I'm gonna have her turn all the way left. There you go. We're gonna straighten everything out. There we go.
For someone with olive skin,
so that's the problem. This laser is unfortunately, especially even at the setting that I'm doing, it's really only for very light skin tones. For those that do have more olive complexion or mixed ethnicity, we may be able to use this very light, but we may have to do something else. We'd have to see, we'd have to consult with you. She even pre-treated her skin regardless because she really wanted me to go super strong. So what I'm gonna do is, that looks pretty good. I'm gonna have her turn all the way to the right. We're gonna let that sit. The thing about this laser is the swelling doesn't kick in immediately. Sorry, I'm starting on the other side. It takes about 5 minutes. So we're gonna go back there in a second and I'll show you guys.
now if you have olive skin, how long after Accutane can you do ablative laser?
We do ablative laser while on Accutane. I just have to see you to determine what type of laser and if we need to pause it for a short time period or if we need to pre-treat you or what. Normally on Accutane we would choose to do a non-ablative laser and then do an ablative afterwards, but we can do it either way. Let's talk to you, appointments@jasonmrmd.com. And I don't claim to be the best in the world. I just claim to have done a lot of treatments and to really care about our patients. So that's what we're doing today. We're doing one of the best treatments I know for her that's going to give her the most result in one treatment.
How well does this work on hyperpigmentation?
This is not for hyperpigmentation at all. This is for sun damage, wrinkles, scarring, deep pores, texture.
Can darker complexions get this laser too?
No, this is for light skin tone, just like we just said. Yeah, only light tone. And the great thing for her is she's super light, so we can do really strong to get her a big result. That's the key.
Now for post-care, what products are you using?
So for her, we're really going to need very specific growth factors, exfoliating cleansers, as well as sheet masks. We always use vitamin B, and within a week we're going to start retinol, vitamin C, and even a lightening serum. There's also some recovery serums that we use that have growth factors and occlusives. So it's a combination of things that you guys can get at emeragecosmetics.com. but also it's really customized, to be honest. It's a lot more extensive. I always tell people, if you go to the gym and you work out, but then you never eat right or take any supplements, you don't get the same results. By doing the skincare and doing the pre and post, her result's gonna be like doing 2 lasers. She's gonna get a better result than if she just did the laser alone, which may or may not make it heal well.
So for those that watch your other lives, what is this entire procedure called?
The entire procedure is called CO2 Laser for acne scars. This is our deep portion, but we also did subcision and filler already. So it's a combination treatment for acne scars.
So I need something like this, but I have darker skin. What can they do?
We need to customize the treatment. Take a look at you. We might be able to do halo. We may have to do lighter treatments over time. Appointments at jasonemermd.com. Let's look at you and customize what we need to do. This is our customized treatment plan for her. She wanted strong. She wanted a big result, one treatment.
You do virtual consultations too, right?
Oh my God, we do tons of virtual consultations. My patient here did a virtual consultation, and she did skincare at home before coming in. So now we're gonna go back and do one more pass here at the end.
Now, what settings do you use for this patient?
Well, that's proprietary, guys. Can't tell you that. But this is a very strong setup. So let's turn now. Let's take a look. Oh, perfect. So if you take a look, there's the dewdrops. You see the dewdrops? Those little dots of sweating. That's the deep swelling from this laser. The pinpoint bleeding. This is perfect. Just want to make sure everything's real even. Everything's looking great.
Yay!
It's looking really good. You're doing phenomenal.
Thanks.
Barely can talk, but it's great. Now, let me see the opposite side. This is really, really good. Very even. If you zoom in, you can see all the little squares and little dots. I'm gonna do a little pass up here. I'm very happy for her. We're on to our last portion.
For those that think that's what it's gonna look like, it's obviously this is chest. Not what it's gonna look like right now.
Oh no, this is our treatment, guys. This is the long-term plan that's happening right now. This is like the start of your first workout. Okay, so that's our deep laser. We're now gonna go to the superficial laser in a few minutes.
Okay.
She's ready. Okay, I'm gonna put a teeny bit more.